It gives me great pleasure now to welcome Ramesh Pandey, Dr. Ramesh Pandey, who is a radiation oncologist in Palmerston North in New Zealand, but we're talking to you today in Singapore, which feels amazing. Welcome. Can you tell me, cancer patients in New Zealand, do some struggle to get access to radiation therapy that could benefit them?
Absolutely, Julie. We've got quite a unique situation. We've got a small population that's dispersed throughout a large region. And now some of our patients travel 3 hours, 2 hours just to get to their appointments, for investigations, for treatments. And some treatments, as you're aware, can last up to 6 weeks, 30 sessions. So getting people to attend appointments is a big issue. And staying the course for that period of time away from family, friends, business can cause a huge amount of burden on the families and also financial hardships.
And what will help improve access so that everybody who could benefit actually gets the radiation? What are you trying to do now, and what more do you hope to do?
There's a lot that has been started already. There's still a lot more to be done. For instance, we found that having linear accelerators close by to patients is probably a step in the right direction. In the last few years, there has been a move to try and increase the number of replacements that we're doing for our older machines, and that changes the treatment times. So it's shorter, and potentially we might use more sophisticated techniques that reduce the overall duration of the patient being away from family and friends and work.
And the development of the workforce, the training of the workforce, that's a critical issue, isn't it, in terms of improving access?
Oh, Julie, that's an item close to my heart. We see a lot of trainees come, we train them very well, but they don't always stay, unfortunately. And then we've got this also added issue of our workforce retiring soon. A large number of our current radiation oncologists will retire in a very short while. New Zealand is actually at the edge of a cliff in terms of radiotherapy services. And unless we actually take stringent action to try and remedy this, we as a country will be struggling to provide quality care in a timely fashion for our patients.
Ramesh, thank you so much for talking to us.
Most welcome.
Ask you, how big is the gap in terms of survival after a cancer diagnosis between Maori people and non-Maori people in New Zealand? Because as you would know, in Australia, there is a big gap between Aboriginal and Torres Strait Islander people and the general population.
Yeah. Similarly here in Aotearoa, New Zealand, Māori are 20% more likely to develop a cancer and twice as likely to die. And actually at every point of the cancer care continuum, we know through research that is ongoing in Aotearoa, New Zealand here, that Māori, it is inequitable in terms of survival and outcomes. Māori are known to generally, the Māori population, we know, generally present later with a cancer diagnosis. So, therefore, your ability to access different types of treatments can be limited if you've got, a more advanced cancer. So if we can, redesign the way that we, provide our services, I think, it will have an impact.
Wherever we live, we deserve the best possible chance to survive cancer and get the treatment that we need.
Aboriginal people should be able to access radiation therapy if they need it.
Right now, there are Aboriginal and Torres Strait Islander cancer patients who are struggling to get the radiation therapy that they need.
In some parts of the world, it's impossible for most cancer patients to get radiation therapy.
Māori should be able to get access to radiation therapy if we need it.
The Targeting Cancer campaign is supporting the work to close the care gap in radiation therapy at home and abroad.
To learn more and to find out how you can help, please visit the Targeting Cancer website.